Good day, everyone. For today's video, we are going to talk about drugs acting on the endocrine system. So, what is hormone? Hormone may be defined as a specific chemical synthesized and stored in a specialized cell or tissues called endocrine glands and maintain homeostasis within the body. Next is adrenal corticosteroids. These are steroid hormones produced by the adrenal cortex which influence carbohydrate and electrolyte metabolism and small amount of androgens. Major hormones are subdivided into two classes. The first one is glucocorticoids, whose actions are principally on carbohydrate but also protein and fat metabolism. The second one is mineralocorticoids, which are responsible for regulating electrolyte and hence water balance. In kidneys, they enhance the resorption of sodium and chloride, increase the rate of loss of hydrogens, potassium, phosphate, and calcium. They also increase the gluconeogenesis, and on vascular smooth muscle, sensitize to noradrenaline and maintain normal capillary permeability and myocardial contractility. Furthermore, glucocorticoids exert anti-inflammatory and immunosuppressive effects, which are generally regarded as pharmacological effects of glucocorticoids and shared by NSAID. The biosynthesis of glucocorticoids is inhibited by metapyrone, which can be used as a diagnostic test to assess ACTH secretion. Aminoglutathione and ketoconazole also inhibit steroidogenesis. These drugs can be used in treating Cushing syndrome. Principles of corticosteroid therapy. Dosage schedule. Higher doses result in atrophy of adrenal cortex and permanent hypofunction of the gland. When prolonged therapy is required, small doses are selected. Corticosteroids do not cure the disease, but has anti-inflammatory effects. These should be avoided during active infections unless compulsory. For chronic infections, local application should be preferred. These should not be used simultaneously with immunization or vaccination schedules, and should be contraindicated in the following conditions. Clinical uses of corticosteroids includes ketosis, pregnancy toxemia in O's, stress, anti-inflammatory effect, and induction of parturition. The pancreas, which lies in the loop of duodenum, contains two vastly different types of glandular tissue. The first one, the greater part of the gland, is exocrine gland and secretes a fluid rich in digestive enzymes via the common bile duct into the small intestine. The second one is an endocrine gland, which is islets of Langerhans. Cells secrete the stored polypeptide hormone insulin in a rapid response to GI peptide hormones, plasma concentrations of glucose, amino acid or fatty acids, and other local or systemic drugs. Glucagon, a smaller single-chain polypeptide secreted by the islet 2 cells. Injection of insulin. It is a sterile anti-diabetogenic hormone of the pancreas of either the pig or the ox, appropriately purified. The rate of absorption of insulin and its duration of action depends upon the physical state. 48 hours for protamine zinc insulins and 24 hours for globin zinc insulins for 40 or 80 units per ml. Lenta insulins. These are preparations of insulin with increased amounts of zinc incorporated in their crystals to reduce the solubility of the insulin in the body fluids. Lenta insulins are well suited to once daily injections, having an 18 to 24 hour duration of action after subcutaneous injection. Hormone MW5700 is a polypeptide composed of two straight cross-linked chains of 21 and 30 residues per chain. These are some minor interspecies sequence variations. The commercial product was of porcine or bovine origin, but is now obtained from genetically engineered Escherichia coli. Mechanism of action of insulin. After binding to specific cell membrane-located receptors, insulin increases the rate of entry of glucose, amino acids, and potassium ions into most cells. This reverses the hyperglycemia of diabetes mellitus by allowing excess glucose to become intracellular. Inside the cell, protein synthesis is increased and glucose is phosphorylated by ATP and hexyl kinase and is used to derive energy or for incorporation into glycogen. The storage of carbohydrate is further aided by the inhibition of the action of the enzymes of glycogenolysis. Protein synthesis is aided by the impairment of gluconeogenesis, and insulin facilitates fat deposition and strongly inhibits lipolysis. Insulin release is affected by hyperglycemia. Furthermore, insulin, growth hormones, and steroid hormones are anabolic in effect. On the other hand, glucocorticoids, thyroid hormones, glucagon, and catecholamines are catabolic in effect and exert actions opposite to those of insulin. Next is sulfonylureas. These are orally active hypoglycemic agents, which are hypoglycemic sulfonamides. Its action is a direct stimulation of the secretory activity of pancreatic cells plus a sensitization of target cells to receptors. Moreover, they cannot alter blood glucose concentrations in pancreatectomized and juvenile animals, suggesting that sulfonylureas stimulated the pancreas to stimulate insulin synthesis. In general, it is the major therapeutic agent used to treat type 2 diabetes in humans until recently. There are two types of diabetes, the type 1, which is the insulin-dependent or juvenile onset diabetes mellitus, and the other one, the type 2, the non-insulin dependent or maturity onset diabetes mellitus. On type 1, there is a cell destruction in pancreatic islets, and circulating insulin levels are low or very low, and patients are more prone to ketosis. This type is less common and has low degree of genetic predisposition. In type 2, there is no loss or moderate reduction in B cell mass. Insulin in circulation is low, normal, or even high. This type has a high degree of predisposition and generally has a late onset. And over 90% cases are of type 2 diabetes mellitus. Drugs under sulfonylureas are tolbutamide and chlorpropamide. Tolbutamide is a short-acting member of the group, and chlorpropamide is a long-acting because it is not metabolized.
Sex hormones. The gonads produce steroidal hormones which have androgenic, estrogenic, and progestational activities. Their synthetic analogs have similar or antagonistic actions and form a very important class of drugs. Androgens are substances which cause development of secondary sex characters in the castrated male. Natural androgens are testosterone, dihydroxytestosterone, which is more active form of testosterone, dihydroepiandrosterone, androstenedione, and aldosterone. It is a metabolite of testosterone which is excreted in the urine. Synthetic androgens. They are active orally. These are the methyltestosterone, fluoxymesterone, testosterone androquinate, and the mesterolone. Actions of androgens: growth of genitals and hair, thickening of skin, increased activity of sebaceous glands, loss of subcutaneous fat resulting into veins looking prominent, normal spermatogenesis and maturation of spermatozoa, skeleton and skeletal muscles, which is anabolic, pubertal spurt of growth in boys and to smaller extent in girls, and it accelerates erythropoiesis. Its pharmacokinetics are: testosterone is inactive orally. Intramuscular injection of testosterone is also of short duration. Its metabolites are androsterone and ethylcolanolone. Plasma half-life of testosterone is 10 to 20 minutes. Synthetic androgens are metabolized slowly and have a higher duration of actions. For its uses: testicular failure, hypopituitarism, AIDS-related muscle wasting, teaser bulls. Testosterone-treated cows were as effective in ostrich dissection as surgically altered bulls. Steroids are synthetic androgens with supposedly higher anabolic and lower androgenic activity. Its anabolic form are nandrolone, oxymetholone, stanzolol, methandienone, and its uses are growth promotion, enhancement of physical ability in athletes. Anti-androgens. So first we have the delmadinone, recommended for the control of the hypersexuality in male cats and dogs and for relieving prostatic hypertrophy. Cyproterone, it is a derivative of progesterone and is a competitive antagonist of dihydrotestosterone. It is used in the treatment of male sex offenders. Estrogens are substances which can induce estrus in spayed animals. Natural estrogens are estradiol, major estrogen secreted from ovary. It is the most potent. Estrone, estradiol is oxidized in the liver to estrone. Estriol, estrone is hydroxylated to form estriol. Equilin, 1/5 estrogenic potency of estradiol. Synthetic estrogens are steroidal estrogens. These are the ethinyl estradiol, mestranol, and tibolone. Non-steroidal estrogens are diethylstilbestrol, used orally, zeranol, analog of naturally occurring plant, and estrogen, zearalenone. Actions of estrogens: sex organs, pubertal changes, secondary sex characters for development. Estrogens are anabolic similar to but weaker than testosterone, important in maintaining bone mass. Pharmacokinetics. Natural estrogens are inactive orally. Estradiol esters injected intramuscularly are slowly absorbed and exert. It has a prolonged action. Ethinyl estradiol is metabolized very slowly. Its plasma half-life is 12 to 24 hours. Orally active and more potent. Its uses is hormone replacement therapy, growth promotion in animal induction of lactation in cow. Anti-estrogens. Tamoxifen is used in the treatment of estrogen-dependent breast cancer in women. Clomiphene and cyclophenil, which inhibit estrogen binding to hypothalamus and anterior pituitary, preventing normal feedback of estrogens, is used to treat lack of ovulation in infertile women. Natural progestins. Progesterone, 21C steroid, half-life 5 to 7 minutes. Hydroxyprogesterone caproate, longer-acting injection. For synthetic progestins, megestrol acetate, dihydrogesterone, medroxyprogesterone acetate, they are weak androgenic, mibolarone, melangesterol acetate, orally active, used to suppress estrogen in fattening female cattle, progestone. Actions of progesterone. In uterus, it brings about secretory changes in estrogen, primed endometrium, hyperemia, tortuosity of glands. It also decreases sensitivity of myometrium to oxytocin. In cervix, converts the watery cervical secretion to viscid mucosal plug. In mammary gland, proliferation of acini of mammary gland, and in combination with estrogen, converts udder for milking. In CNS, high circulating level of progesterone appears to have sedative effect. It causes a slight rise in body temperature, restoring hypothalamic thermostat. In pituitary, progesterone is a weak inhibitor of gonadotropin secretion from pituitary. It decreases frequency of LH pulses by action on hypothalamic pulse generator, so suppresses ovulation. Its uses as contraceptives in human, HRT along with estrogen, progesterone is also given in HRT for few days to avoid chances of endometrial carcinoma. Threatened or habitual abortion, postponement of estrus in bitches, megestrol acetate, mibolarone, induction of lactation in the cow, synchronization of estrus cycle. Antiprogestins, they may act as abortifacients. Mifepristone, along with a prostaglandin derivative, proved to be very effective in terminating early pregnancy in women. Thyroid gland secretes 3 hormones. These are the thyroxine, triiodothyronine, and calcitonin. Both T4 and T3 are iodine-containing derivatives of thyrosine, which is a condensation product of 2 molecules of amino acid tyrosine. The thyroid hormones are synthesized and stored in thyroid follicles as part of the thyroglobulin molecule. Iodine uptake, oxidation and iodation, coupling, storage and release, peripheral conversion of T4 to T3. Actions of thyroid hormones. First, growth and development, cretinism, congenital deficiency of T4 and T3, myxoedema, adult hypothyroidism, Graves' disease, hyperthyroidism. Second, intermediary metabolism, lipid, carbohydrates, and proteins. Number 3, caloriogenesis. T3 or T4 increase BMR by stimulation of cellular metabolism. CVS cause hyperdynamic state of circulation. In nervous system, cretinism and Graves' disease. In GIT, propulsive activity is increased. Hypothyroidism, constipation, hyperthyroidism, and diarrhea. Anti-thyroid substances. First, natural goitrogens, goitrine. Second, thiourelenase. Third, non-thioureline antithyroid agents, ipodate, radioactive iodine. Antithyroid substances find occasional use in treatment of hyperthyroidism. That's it. Thank you for listening.